Good morning again, everyone. Welcome to today's session. My name is Dr. Kiara Matthews. I am the program coordinator for the speech-language pathology programs at the University of the West Indies, St. Augustine, in the Department of Modern Languages and Linguistics. Welcome again to our first webinar in our 2024 series on augmentative and alternative communication. Without further ado, I'm going to pass you over to our final year student who will conduct today's webinar. Thank you for joining us.
Good morning, everyone. Thank you, Dr. Matthews. Today is our first webinar, as Dr. Matthews said, and please be sure to tune in on May 24th for oral rehabilitation and May 31st for fluency disorders. Today, we would be discussing augmentative and alternative communication, or AAC. Our team members are myself, Aaliyah Lawrence Carter, Javon Frank, Kanisha Barkley, Meredith Montrouchard, Rennie Lewis, and Celicia Bash. I would now hand you over to Kanisha, who would tell you a little about the MA in SLP.
So let me tell you a little bit more about our program. The current cohort runs from 2021 to 2024, and yes, that means we are the graduating class. Our cohort size is 17 students. Let me tell you some more about the objectives. The objectives of the professional training program for speech-language pathologists are to impart comprehensive theoretical knowledge and practical skills essential to the field, to serve the Caribbean region by cultivating intellectual and professional capacity in this specialized domain, and to educate public on available support for individuals with speech, language, and learning disabilities. Additionally, the program aims to offer screening for the entire school-age population, providing assessment and follow-up services, deliver rehabilitation for aphasic individuals, provide assessment and follow-up services, deliver rehabilitation, deliver rehabilitation for aphasic individuals across the region, and extend support to neonatal facilities where infants face swallowing disorders at birth. The program targets persons with undergraduate certificate in speech-language pathology or equivalent who wish to become professional speech-language pathologists. The qualifications for entry or prerequisites: students entering the program should normally be graduates of undergraduate or certificate program of speech and language science or a closely related field. In this case, a minor in SLP alongside a closely related undergraduate degree, for example, linguistics, or some type of equivalent coursework, and should fulfill the normal matriculation requirements of the university. The duration of the program is 3 years. Some courses of interest that we would have completed is SPLP 6004, which is Clinical Practicum 4, 6009, Fluency Disorders, 6011, Augmentative and Alternative Communication, and 6012, Oral Rehabilitation. Now that you're up to speed on what the MASLP program is about, I will hand you over to Meredith, who will begin our presentation.
Thank you, Kanisha. So let's go headlong into our session this morning. We have a lot of information for you. We will start by answering the question, what is AAC? AAC, which stands for Augmentative and Alternative Communication, is an area of clinical practice that supplements or compensates for impairments in speech-language production or speech-language comprehension, including spoken and written modes of communication. What this means is that AAC falls under the broader umbrella of assistive technology that can be used to assist you in communicating. So AAC can refer to a tool, a strategy, or a piece of equipment which will help you to improve functional daily living in people with disabilities or limitations. To continue, AAC uses a variety of techniques and tools that support or replace spoken communication. These tools help the individual to express their thoughts, their wants and needs, their feelings and ideas. And some of them include gestures, for example, shaking your head yes or no, finger spelling, drawing letters or words in the air, line drawings, alphabet boards pointing to letters on a board, picture communication boards, and speech generating devices, which are also known as VOCAs, voice output communication aids. We will look at some of these in more detail further in the presentation, but now let's continue by talking about who uses AAC. Let's look at the first A in AAC. The first A stands for augmentative, which means to increase or to add to. So for people who have speech, but their speech is difficult to understand, AAC can support them in communicating more clearly. Some of the people who can benefit from the augmentative use of AAC are those with the following conditions: cerebral palsy, childhood apraxia of speech, those who are hearing impaired, and individuals with autism. And then there are also people with progressive neurological conditions, such as multiple sclerosis, Parkinson's disease, muscular dystrophy, and ALS, amyotrophic lateral sclerosis. In this video, we will see an example of the augmentative use of AAC.
So some people look at me, and then they're like, "Then pops off." Look, the end right about that, right?
In this clip, a boy with cerebral palsy who speaks very softly uses a microphone to help him be heard in a noisy classroom. Now let's look at the second A in AAC. The second A stands for alternative. In this case, AAC replaces typical speech either permanently or for an extended period. Some of the people who can benefit from the alternative use of AAC are those with the following conditions. There's autism, individuals with developmental language delay, and then there are those with acquired conditions or those with surgical trauma. And this includes people with stroke, people who underwent a laryngectomy, where all or part of the voice box was removed, and people who underwent a glossectomy, where all or part of the tongue was removed. In this video clip, we will see an example of the alternative use of AAC.
Hi.
Now I can greet my good friend,
Hi.
Brian, exactly how I want to.
Homie.
In this clip, a man with autism and apraxia uses an alphabet board to spell out words so that he can say exactly what he means. Hi, my homie. For many AAC users, they will need AAC support for years or for all of their life. However, there are instances where the use of AAC is temporary or short-term. Some of the people who will use AAC temporarily are those with conditions caused by accidental trauma, for example, injury to the face from a fall or from a car accident. And then there are those who will use it due to medical trauma. For example, AAC may be used by patients after an operation, or even if someone has a really bad sore throat. So individuals like these, they can use eye contact, facial expressions, gestures. They might use an alphabet board, or they might use a device, all on a temporary basis. My classmate, Celicia, will now speak to you about the main types of AAC.
Hi, everyone. So on this slide, we look at two main types of AAC. With unaided AAC, there is no external equipment or technology, so the body is used, face, hands, etc. With aided AAC, some form of equipment or technology is used. This is divided into three categories: light tech, mid tech, and high tech. High tech AAC can be dedicated devices intended for communication purposes only, while other integrated or non-dedicated devices have features that let the device perform as a computer, access to internet and television, etc. Next slide. Examples of unaided AAC include facial expressions, vocalizations and speech approximations, gestures and body movements, sign language, and eye codes. Aided AAC can be divided into 3 categories: light tech options, mid tech options, and high tech options. Light tech refers to a non-electronic communication system used outside of the body. Examples of light tech AAC are alphabet boards, picture communication boards, communication books, pragmatically organized dynamic displays, or POD, calendars as a reminder, lists. These are some of the options for light tech AAC. With this video clip, we can see a child using a picture communication board.
Blueberries.
There we go. So the child uses the picture communication board to request want blueberries. Mid-tech. So examples of mid-tech AAC. These include devices which play a single message that a user or caregiver can record and then play. The Big Mac, talk points, and talk blocks. Step-by-step plays more than one message, so there are multiple sequential recorded messages. Mid-tech AAC. So with this video clip, we can see a Big Mac being used.
Blank. Blank.
Oh no!
Blank. You're very gesture, aren't you?
Oh no!
Blank.
No!
Blank.
No way!
He likes it. Oh no!
The Big Mac is used so that children can comment. It plays, oh no, when the toy is wet. Next, we move on to high tech, right? So high tech AAC is a computer based and uses speech generating technologies with a wide range of applications and digital devices and media. High tech AAC can be further subcategorized into non-dedicated devices, such as an iPad or an Android tablet with AAC software, or dedicated devices, such as one from Tobii, which is used only for communication purposes. In this video, a boy with apraxia asks and answers questions by touching icons on his device, which then plays specific words and phrases.
How are you?
I'm fine. How are you?
What's your name?
My name's Johnny. What's your name?
My name is Emily.
Good
Nice to meet
boy.
you.
So he uses the device as his voice. I will now hand you over to Meredith, where she would speak on communicative functions of AAC. Thank you.
Thank you, Celicia. So far, we've looked at several examples of how AAC is used. There was Javier, a boy with cerebral palsy who used a microphone to amplify his voice and participate in class. There was Gregory, a man with autism, who used an alphabet board to greet his friend. Hi, my homie. There was a little boy who used a picture communication board to request blueberries. There was a group of children who used a Big Mac to comment, oh no, when their toy bear was wet. And last, as you just saw, there was Emmett, a boy who used his speech generating device to ask and answer questions. So AAC has several communicative functions. Some of the main ones are listed here: requesting, protesting, describing, asking and answering questions, commenting, and expressing feelings. Now, it's important to note that many communication functions overlap. You may express that you're in pain while answering a question at the same time, or you can comment on something that you like and then request to do it again because you like it. It makes you happy. So we use these communicative functions throughout our days, which is why individuals who are learning how to use AAC tools and devices should be provided with many, many, many opportunities to do so as well. When looking at the various options for AAC, unaided or aided, light tech, mid tech, and high tech options, it's important to consider the following: the communication skills that the individuals possess, what they can be expected to develop, what is important to them and their family or caregivers. We also need to think about their existing language skills, because individuals with robust language skills may be able to comment or ask questions in multi-word phrases or sentences. For example, and an adult who underwent a laryngectomy, who had all or parts of their voice box removed, they will have an intact language system. But then you may have individuals who are developing or emerging communicators and who may have not yet expressed their first words. And so they may only use one or two words at a time. For example, they may communicate about a preferred object or a person. They may say ball or mom or dad. Why are speech and language pathologists experts in AAC? First of all, SLPs are trained in several areas related to AAC. They are knowledgeable about AAC techniques. They are experts in the use of language, oral language, and written language. They understand the use of various interaction patterns with different communication partners. They know the different muscles that are used for the production of speech. They are knowledgeable about nonverbal communication. They can evaluate the communicative competence of someone who is a candidate for AAC, and they can guide users in selecting the appropriate vocabulary and pictures for AAC. So all of these factors make SLPs experts in AAC. Now, I will hand you over to my classmate, Renee Lewis.
Thank you, Meredith. In this area, I'll be focusing on how the SLP decides the type of device that is best suited to the client. To do this, the SLP does an evaluation where they assess the person's current receptive and expressive language skills. For this assessment, they will consider the user's current means of communication and its effectiveness. So this will include both verbal and non-verbal communication. They would consider the vocabulary size and the types of words that the person uses and understands, the word combinations and grammatical forms that they use and understand, the person's ability to follow instructions, their ability to respond to yes/no questions, and their ability to correctly point to objects, words, and pictures when given an auditory stimulus, so when given a verbal instruction. They will also consider the person's articulation skills. So this would consider speech intelligibility, so how clear or understandable they are to their communication partners. Someone with low intelligibility due to articulation disorders, which could range from things like incorrect tongue placement, maybe even cleft issues, because articulation considers the function of the articulators, which are our tongue, velum, teeth, things like that, as well as the structural aspect of these articulators. So someone with an articulation disorder would be able to use AAC while they are going through treatment to deal with the articulation disorder to ensure that their communication doesn't suffer in the interim. The speech therapist would also look at the person's cognitive skills. So this would look at the user's memory, their attention, problem-solving skills, and like executive functioning skills that are required for functional AAC use. They would also consider the person's motor skills. So this looks at the means of access to the AAC system. So things like positioning and the range of their fine and gross motor skills. Because someone with fine motor skills would have this difficulty like isolating one finger, their pointer finger to accurately select a symbol. So they may require like a larger grid size. So larger grid size means larger images, pictures, so that they could use a more general hand touch to select. They will also consider vision. This would obviously influence the user's ability to see the symbols or text on the system, the AAC system. It also comes into play with someone who may need eye gaze to navigate their device. Their integrated sensory system would also be looked at. This will consider the person's ability to regulate and ready their body for communication. And this is most times seen in people with autism who usually struggle with sensory regulation. Hearing would also be looked at by the speech therapist because this would influence the user's ability to hear, process, and comprehend speech, as well as literacy skills. So literacy skills will influence feature matching, which we will be told about later on, right? Feature matching aspect of the AAC process. So this will consider should the person only use pictures. If the person is illiterate, pictures may be used. If the person is literate, you may use picture and text, and sometimes even include a keyboard or letterboard so that the person is able to type their own questions if they don't have something pre-selected on the AAC system, or even type their own responses. So now I'll hand you over to Aliyah to tell you a bit about what to expect during an evaluation.
Thank you, Rennie. So I would be discussing what to expect during an evaluation. Okay, so speech and language assessment is a complex process. Assessing, describing, and interpreting an individual's communication ability requires the integration of a variety of information gathered in the evaluation process. The American Speech Language Hearing Association, or ASHA's, preferred practice patterns for the professions of speech language pathology indicates that a comprehensive speech and language pathology assessment includes the following components. The actual assessment is divided into two parts, and the first part is known as the pre-assessment. In the pre-assessment, we firstly have the case history. This is also known as the intake form. It's the starting point for understanding clients and their communicative problems. A case history form is typically completed prior to the initial meeting, and it enables the clinician to anticipate those areas that will require assessment, identify topics requiring further clarification, and pre-select appropriate evaluation materials and assessment tools and procedures to use during the evaluation session. So the case history, it includes, but is not limited to, the families and the clinician and the client's medical history, their educational background, their socioeconomic, cultural, and linguistic background information. However, there is a limitation of the case history form because the respondents, they may not always understand the terminology on the form. And this takes us to another important component of the pre-assessment known as the client interview. And the client interview, it's a bit more open-ended as it allows the clients and the clinician, well, it allows the clients to express clearly their greatest concerns regarding their language difficulties. And it also allows the clinician to have a deeper understanding of their home setting as it relates to the client's language use. It will also allow the clinician to go through the case history form and clarify any information that was received that may have been ambiguous. Another important part of the pre-assessment is information from other professionals, and this information is sometimes available from other professionals or collaborators of the client. And this information is often helpful for understanding the disorder more thoroughly before actually making a diagnosis. And some associated professionals or collaborators, they would include other speech and language pathologists, audiologists, occupational therapists, physicians, pediatricians, neurologists, regular or special educators. Okay? So these three components that make up the pre-assessment, they are very important as the preliminary information gathered combined with the actual assessment results. It will enable the clinician to make an accurate diagnosis and develop the most appropriate treatment recommendation. Okay. So once the clinician, they have gathered all of the pre-assessment information, then they are ready to begin the actual assessment. They are not AAC assessment tools. They are not widely used in Trinidad and Tobago. However, we would still like to share with you all some of the assessment tools that are out there. So the first one is called SET Framework, and this was developed by Joy Zabala. And it's a 4-part model intended to promote decision-making in assistive technology service delivery from consideration through implementation and evaluation of effectiveness. So SET stands for the S, student, so all of the information pertaining to the person who would use the AAC, their physical, sensory, intellectual, and educational data. The E, environment, so who is in the person's network and where does the person need to go? So for example, are they going to church, home? Are they going to a restaurant? Things like that. The first T is task, and this has to deal with their communication goals. So what are their communication goals? And the second T is tools. So this has to do with feature matching, which AAC system will be the best to achieve their goals. The second assessment tool is called the AAC profile, and this was developed by Dr. Tracy Kovac. This is an assessment tool that measures subjective functional skills for developing communicative competence using the AAC systems, and it can be used for the initial assessment, to reevaluate skills, and also to monitor progress. It's divided into ability-based levels based on the 4 areas of communicative competence. So the first area is operational competence, and this has to do with the technical and physical skills required to operate, access the AAC system, and transmit information to others. The second component is linguistic competence, and this has to do with the development of the receptive and expressive language skills used at home and in the community. The knowledge and use of the language code of the AAC system, and the ability to attend to a communication interaction. The third component is strategic competence, and this has to do with using the knowledge of what can be communicated and how best to communicate this, including compensatory strategies for effective communication. And the fourth component is social competence, and this deals with the development of skills needed for social communication and the desire to communicate reciprocally with others. The third assessment tool that we'll be discussing is Mosaic. This was developed by Dr. Andy Schmidt. And Mosaic, it stands for a model of observational screening for the analysis of interaction and communication. This tool is designed to provide a structured approach. This tool is designed to provide a structured approach to observing the communication skills of children and adults with an intellectual disability. It contains easy-to-use forms designed to structure the clinician's observation of a person with a disability, and it allows them to pinpoint exactly how much a client understands and how much they communicate using behavior, speech, and a range of symbols. So I will now hand you over to Javon, and he would be talking to you about feature matching, which also falls under the evaluation process.
All right, thank you, Alia. So feature matching is a collaborative process which involves using criterion-based assessment strategies to gather relevant information about a client's communication and sensory motor abilities, and applying AAC expertise to match the appropriate array of AAC options that offer features relevant for meeting the person's needs and abilities. The process of feature matching should be guided by the following principles. There must be multiple contributors. The individual must have access to a variety of AAC tools and systems. They must also implement it. The individual implementing it must also be knowledgeable about the rapidly changing technology coming to market. Another principle is that it's an ongoing process and ensuring the optimization of the selected device for the individual. So it's not something that you set and leave alone. You always have to review to make sure it's still applicable for that individual as they develop. Combining features is often necessary to satisfy all communication needs. can be achieved through the use of post-sentence construction. So your is and symbols to get the individual to be able to communicate effectively. The individual's current needs, abilities, and future language growth must be taken into account when selecting an AAC device. And finally, the AAC user, their primary communication partner, as well as the AAC specialist, should all be actively involved in the discovery process in order to select the most applicable type of device. Next slide. Three of the main features that should be looked at when selecting an AAC device are symbol features, linguistic features, and voice features. So I'll just go into a little detail about each three areas. Symbol features look at the selection of the type of representation that is displayed on the device of the user. It runs on a continuum going from real objects to photos of real objects, then to concrete line drawn representations of the object, to abstract symbols representing concepts, and then finally to text. So examples of this could be photos, and you have other tools such as BoardMaker, Symbol Sticks, Unity, and Text, Braille, and other app-specific methods. Regarding linguistic features, this refers to the integration of the presented symbols into the device. They can be integrated using full phrase communication, which is having one area represent an entire phrase, word-by-word sentence construction, which is when a cell represents word. And they have to connect each base spelling of words, which also includes an individual's cognition level, physical abilities, and receptive and expressive language skills. Looking at the features, when selecting the appropriate voice, which will represent the individual's unique characteristics and allow them to best be understood by their communication partner, is important. You want the individual to feel as if they are speaking through the device, and the device is not separate and apart from them. The device is basically their voice, and it helps them to interact with the wider world. So I now pass you on to Kenisha to speak about what to expect during an AAC intervention.
Okay, so hi y'all. So what to expect during intervention? Now, after the assessment process, the SLP will work with the client on acquainting them with the communication system technique recommended by the SLP during evaluation, once agreed upon by the client and their caregivers. As mentioned earlier, these techniques can be further broken down into aided and unaided methods and techniques to communication. In the intervention process, this is mainly concentrated in training the client and their caregivers in the communication system of choice. I will explain more in this section how the training process will be addressed. Now, training involves providing the AAC method or device. This would have been addressed in the evaluation process and agreed upon between the SLP based on their AAC recommendation and the parent or caregiver's approval. The next point is modeling. The SLP will always model the responses, as this is an important factor in the teaching process of AACs. The SLP will use the device or method while speaking it aloud, as language learning is dependent upon language input. This applies to AAC as well. Your SLP will then focus in on goals that are of primary communicative function. These are the functional building blocks of communication. So the SLP will focus on goals of requesting, refusing, commenting, asking questions, sharing information, and social closeness, as mentioned earlier by Salisha. Right, now in order to accomplish successful modeling, you will see your SLP employs some strategies as seen here. The say what you see, commenting, self-talk, narrating, and describing strategies are all used in in combination to ensure a fun and sociable interaction between the SLP and the client. These strategies are taught to the parent or the caregiver during the session. The SLP will take the opportunity to become acquainted with words that are important to the client for populating their AAC device or for use in their AAC method if it is an unaided option. These words are called core words and fringe words. Core words are the words that are abstract and there isn't a picture that can be used to describe them. So example, the verb put or the words what and when. Whereas fringe words are those more concrete words and can be associated with an image. Example, dog or nose. All of these words are relevant to aided and unaided communication. However, let's look more into the aided types of communication and the strategies and techniques used in session. In the evaluation process, the SLP would recommend the suitable type of AAC for your loved one, whether low-tech, high-tech, or even mid-tech options. Ever the choice, the SLP will work with the caregiver or the parents to populate the AAC device with the suitable fringe and core words. As the client uses the words in sessions, the SLP will use the strategies as seen below to attribute meaning to what the client is aiming to say. Now, this is not predicting what they're saying, but giving meaning to one word or multiple words used at any point in time. Say what you see appears here again. As we already established, modeling is key. Acknowledging AAC exploration is where the SLP positively comments on the client's interaction with the device, regardless of the message conveyed. Validating what is expressed is close in relation to acknowledging. However, this is positive reinforcement where the message may be enacted. Combining unrelated words into a possible message involves the SLP attempting to interpret the message that the client is relaying despite the words being unrelated. Connecting the message to a known or related person, activity, or experience involves the use of potential one-word messages in the context of conversation and relating this message to an experience or a person or activity. Responding and giving more information involves the SLP responding to the communicative intent of the client. Example, go play by the client. And the SLP says, yes, let's go outside and play with the ball. In all these strategies, the SLP will employ pausing and waiting for a response. This allows the client processing time to answer and find the response on the device. All of this involves cognitive and executive functioning processing. The SLP will train the caregiver and the parent on these strategies in session as well. Another important and final factor is that the client's ability to attend. To be able to engage with any of these devices, the client's attention is imperative. In cases like this, the SLP will meet the client at their attention level, and this fosters a good relationship as it relates to learning and attending to their device. The SLP may change visual and auditory features like background colors or images, and the voice that is generated from the device, the speech that is from the AAC device. Then for optimal attending, the SLP will attempt to increase alertness by changing the activity position or any other thing that can make the session somewhat monotonous. The SLP will attempt to create a calm environment as new activities may shift the regular pace of session, and the SLP may dial back to create a slowed pace to calm the client who may be overwhelmed and attending may be limited in that case. Finally, another strategy would be that the SLP will change elements of the environment, which can be distracting and it limits attention. Now, this brings me to the end of this segment, and I will now hand you over to Jevon for tips on how to help at home, work, and school.
All right, thank you. So your child or loved one now has a AAC device. What can you do at home or what can you do at work to help promote the language development of this individual? Firstly, it is recommended that you learn your loved one's device. learn the device and know how to communicate with it, and also know how to program it. So as their needs change, you'll be able to adjust the device to help meet them where they are at that point in time. Allow them to make mistakes. Initially, give them an opportunity to use words and see a response without a right or wrong answer. This helps to teach them cause and effect. If I press this button, this is what I got. It helps with the matching of the item to the picture or the symbol. Provide opportunities for errorless learning. As each skill is taught, they are provided with a prompt or cue immediately following an instruction. The immediate prompt prevents any chance for incorrect responses. So if you are teaching them that this button means juice, as soon as they touch the button, you present them with the box of juice immediately to help reinforce that. As the communicating partner, you should ask open-ended questions. Questions such as, what do you want to drink? What would you like to wear? Where would you like to go? These allow the individuals to pick from a wide variety of possible responses. Assume each communication attempt is intentional. Even though you, as the loved one, you may think you know exactly what your loved one wants at all times, allow them to use the device intentionally. Allow them to select items and see the response that they get from the items to understand that, okay, yes, this is what I want, or this is not what I want, and to try another way. Also, you should encourage communication for a variety of reasons. The individual must be given the opportunity to not only request an item, they should also be given the chance to communicate greetings, rejections, commenting, directing, and also describing. Follow your child's passions and interests. Learning occurs best when the individual is involved, when they feel happy, and not when they don't want to be there, when they feel sad. So following their passions and interests will keep them engaged in the process of learning the device or the system. Model the language at your child's level of communicating. By modeling the language at your child's level, if your child or your loved one is currently speaking at a 2-word level, it's not recommended that you model a phrase that is 5 to 6 words long. You need to meet them where they're at, or if not a little above, to help them to reach into that next level of adding the 3rd word. Allow siblings or others to use the device. Allowing others to use the device will facilitate something called aided language stimulation. This is a way for a communicator to provide a model for communication with the use of the AAC system. Accept all forms of communication. Communication can be presented in many forms, and not because the individual now has an AAC system, that should not be the only form of communication that you as a loved one accept from that individual. If they give you a gesture to communicate something, if they present a facial expression, if they make intelligible verbalizations, those should also be accepted as forms of communication, and you should not request that the child or the loved one say over what they had to say using the AAC system. And finally, you should encourage the individual to use the AAC system. To achieve this, a supportive environment must be created that encourages and reinforces AAC use without pressuring or forcing communication. Surround the individual with positive reinforcement, praise for their efforts, and celebrate their success. Make sure all family members and caregivers are on board and are actively engaging in AAC interactions. Allow them to choose their own voice in the settings, show them or help them customize the buttons or symbols, help them understand how to operate the device well, how to charge it, how to turn up the volume, how to safely store it, and also give them self-advocacy phrases for deciding who can and should touch their device. And to answer some frequently asked questions, I now hand you over to Salisha.
Hi, everyone. So, will AAC negatively impact language development? The simple answer is no. The use of AAC will not delay or impede language development. The current research and our own clinical experience have suggested that AAC will not stop a person from speaking. Instead, it allows for many individuals to express themselves fully when spoken language may be difficult. How do I know if AAC is right for me or my loved one? Speech-language pathologists can help guide you through the decision process. You may notice that AAC is already being used, such as signs and gestures in everyday life. A more robust system can be beneficial for you. The SLP may recommend a more comprehensive evaluation in which various professionals can help select the most appropriate system for you. When may you use low-tech AAC? Water activities or environments? Let's face it, often speech-generating devices and water don't mix well. Light tech boards and symbols are a great alternative. High-tech battery dies. Inevitably, speech-generating devices will lose their charge, glitch, and need repairs or need updates. In these situations, it is essential to have a backup. If you can't afford a second high-tech device, using customized backup pages are an option. Environments with glare. On particularly sunny days or in any environment that results in glares on a device, the device, particularly eye gaze systems, can be hard to see to activate. Light or low-tech systems are much easier in these conditions. And lastly, modeling. So modeling as a second device. If an AAC user does not want others modeling on their system and the AAC communication partner does not have a second high-tech device to use, a dynamic low-tech backup can be used. Next. So what are some free or low-cost AAC options? Listed here are AAC options, or AAC apps, compatible in iOS and Android devices. Certain apps in the list are free or offer, certain apps, oh my goodness, my entire thing shifted. Forgive me. Listed here are some AAC options compatible in iOS and Android devices. Certain apps in the list are free, while others come at a low cost. Please consult with an SLP to assist in guiding the best communication tool for you. What training and supports are provided for individuals using AAC and their communication partners? The training provided for an individual using AAC can vary depending on their specific communication needs, age, and the complexity of the AAC system.
So what training and support, Salisha, when you come back, you can take over if you like. What training and support are provided for individuals using AAC and their communication? The training provided for individuals using AAC can vary depending on their specific communication needs, age, and the complexity of the AAC system. Generally, it includes instruction on how to use the device or software, customizing settings to meet the individual's needs, and developing strategies for effective communication. Communication partners, such as family members, teachers, or therapists, also play a crucial role in supporting individuals using the AAC, and they may receive training on how to facilitate communication and interpret the individual's message accurately. Also, organizations such as the American Speech-Language Hearing Association, or ASHA, and the Assisted Technology Industry Association, they offer resources and education. So some common myths and misconceptions about AAC. Myth number one.
Aliyah, we can have
Yeah.
someone take over.
Okay, thank you.
Okay, so what are some common misconceptions about AAC? Thank you very much, Ilya. I'm not sure what's going on with the internet today. So myth one, AAC is only for nonverbal persons. Reality, AAC benefits many people who have some verbal language. Although some AAC users are nonverbal, many devices users do have some verbal speech. Some examples include a person with good automatic speech, but who is unable to tell a story, or a person who can repeat but not initiate speech. If there's a gap between what a person wants and needs to say and what they are able to say, then some type of AAC might benefit them. In fact, using an AAC device can help build even more verbal speech. Myth 2. AAC is a last resort after traditional therapy has run its course. Reality, AAC and traditional therapy can work together. There is no minimum amount of time to wait post-onset to introduce AAC. Although regaining verbal speech is an important goal for many patients and SLPs, Introducing an AAC device early provides two benefits: meeting the patient's immediate communication needs while also serving as a therapeutic tool to work on verbal speech. Just like a physical therapist does not wait to introduce a walker, an SLP can also empower their patients with tools to communicate right away. Myth number 3, low-tech AAC must be targeted before trying high-tech AAC. Reality: a patient's success or lack thereof with low-tech AAC is not always indicative of their success. With high-tech AAC, low-tech AAC, like a pen or paper or communication board may be a great tool in some circumstances. However, for some patients, it is not motivating or functional due to the lack of voice output and the need for a partner to interpret it. Furthermore, many people are simply more motivated to use a modern high-tech device that resembles the phones and tablets commonly seen today. Myth number 4, a user must be independent in order to be successful with AAC. Although some users will become independent with their AAC devices, many AAC users require some level of partner support when using their device. This could be help with basic operations like charging it, or help with language systems, such as navigating through higher level categories. A partner-dependent user is a successful user if communication has improved by introducing the device. Next slide. So how can AAC be effectively implemented in various settings such as schools, hospitals, and homes? Augmentative and alternative communication, AAC, can be effectively implemented in schools, hospitals, and homes through specific strategies tailored to each setting. So for schools, collaboration is crucial for success of AAC implementation. Regular communication and teamwork help ensure consistency across different environments. Training provides school staff with how to use a device and strategies that are essential for functionality. Developing individual plans based on the student's specific needs and abilities is important in reaching the student's goals. Accessibility, ensuring that the AAC device are readily accessible to students throughout the school. They promotes consistent use and integration into daily activities. For hospitals, assessments, conducting thorough assessments of patients' communication needs is the first step in implementing AAC in hospitals. This assessment should consider the patient's medical condition, cognitive abilities, and communication goals. Consultation, so collaborating with a speech-language pathologist or an AAC specialist for consultations on selecting appropriate AAC tools and strategies is beneficial, as it can provide expertise in matching the right technology to the individual's needs. Providing training to healthcare staff on how to support patients with AAC devices during their hospital stays ensures for effective communication between patients and caregivers. And lastly, customization of AAC systems, specific needs, which meets the specific needs to patients, such as incorporating medical vocabulary or quick access to emergency phrases, can enhance communication efficiency in healthcare settings. So our third point is homes, family involvement. Can you go back up to the previous slide? Thank you. Yeah. So just to speak on homes briefly, family involvement, environmental setup and practice opportunities, routine integration, the use of AAC devices into daily routines such as mealtime conversations, leisure activities, or bedtime routines help individuals become more proficient communicators in family contexts. Next slide. How does AAC therapy collaboration with other disciplinaries such as occupational therapy and special education? So firstly, AAC therapy often works hand in hand with occupational therapy to address the motor planning and execution skills required for effective use of AAC devices. OT practitioners may assist a child's fine motor skills, dexterity, and coordination to determine the most suitable AAC device or assistive technology for their specific needs. They may also provide training on positioning and handling techniques to ensure optimal access to the device. This collaboration ensures that individuals has not only the appropriate communication tool, but also the necessary motor skills to use it efficiently. Secondly, AAC therapy plays a crucial role in supporting special education goals by addressing students' communication needs within their academic setting. Collaboration between AAC therapists and special education teachers can lead to effective implementation of communication strategies in the classroom. For instance, an AAC therapist might train teachers on how to modify instructional materials or adapt classroom activities to accommodate a student's unique communication profile. Additionally, they may provide consultations on using visual supports like pictures, schedules, or social stories to facilitate understanding and engagement in learning activities. Thirdly, AAC therapy can contribute significantly to students' overall development by addressing their social emotional needs through collaboration with school counselors or psychologists, by providing training on using social scripts or teacher appropriate social interactions using technology. AAC therapists can help students build essential social skills that are crucial for successful participation in educational settings. Lastly, multidisciplinary teams develop goals to ensure a holistic approach that addresses all aspects of the individual development. Are there any ethical considerations or challenges associated with using AAC? Yes. AAC presents with various ethical considerations and challenges that need to be addressed. The first one would be autonomy and decision-making. One of the primary ethical considerations in using AAC is ensuring that the individual have autonomy in their communication choices. It is essential to respect the individual's right to make decisions about their communication methods and not impose a specific AAC system on them. Professionals working with individuals using AAC must also involve them in decision-making process to ensure their preferences and needs are respected. Second, privacy and confidentiality. Privacy and confidentiality are significant concerns when using AAC systems, especially in cases where sensitive or personal information is being communicated. Professionals and caregivers must ensure that the individual's privacy rights are protected and any information shared through AAC is kept confidential. Access to communication. Another ethical challenge associated with the use of AAC is ensuring equal access to communication for all individuals who require it. This includes addressing issues related to affordability, availability of resources, training for users and caregivers, and ongoing support to maintain effective communication. Next, we have cultural sensitivity. Cultural sensitivity is crucial when implementing AAC systems, as different cultures may have unique communication styles, beliefs, and values. It is essential to consider cultural factors when selecting or designing AAC systems to ensure they align with the individual's cultural background and preferences. Fifth, we have advocacy and empowerment. Advocacy plays a vital role in addressing ethical considerations related to AAC use. Advocates can help raise awareness about the importance of communication access for individuals using AAC and advocate for policy change to improve access to services and empower individuals. Where can I find AAC role models, right? So we are all shaped by role models throughout our lives, consciously or subconsciously. For someone who uses AAC, it might be harder to establish role models to support self-advocacy and autonomous communications. Here are a few areas to help your AAC user explore. So first, we have blogs. Blogs are great as they offer inside info into the whole picture of what it's like to have complex communication needs. YouTube is great for short, digestible videos that show AAC systems and implementation strategies. Here we have a couple examples. Okay. And we also have fictional media. So books and movies all show role models in different lenses. Here are a couple of books and some movies. Only God Can Hear Me and This Is Not About Me. So these books you could actually find, they're available on Amazon. Some of them you could actually find on YouTube, read aloud. So if you have young ones who are being introduced to AAC, they have someone to relate to. Teens and adults, these movies are great as it analyzes different persons of different ages. And both of these as they go through their daily life in school, at home, and in social environments. Thank you. All right, thank you all for coming to this webinar today.